Good morning, I'm Stephen. I'm based here in Palmer's Green, North London. So I'd like to invite you to imagine that, like the 3 women and 4 men who took part in my single group study, that you too have long-term shoulder pain. From attempting to wash your hair in the morning to getting undressed at the end of the day, what was once a routine task is now a painful ordeal. If you're like my participants, you would likely have visited your GP. After all, shoulder pain is the 3rd most common musculoskeletal pain-related reason for someone to visit their doctor. And you would likely have had a diagnosis and recommended treatment. But evidence shows that chronic shoulder disorders present similar clinical characteristics, and so there's often a lack of consensus on both the diagnoses and the treatment. However, my research suggests that no matter what the diagnoses, your recommended treatment will likely be non-steroidal anti-inflammatory drugs like ibuprofen, physiotherapy, or possibly even surgery. However, the problem I discovered is that anti-inflammatories may actually prolong chronic pain. Most physiotherapy now no longer includes touch, and costly and invasive surgery is no more effective than a placebo. Recent researchers argue that we are in fact over-medicalising chronic shoulder pain. They argue that chronic shoulder pain is an issue of the nervous system rather than damaged tissue, and that the influencing factors are many and complex, including stress, anxiety, and even previous pain experiences. And that as such, we should instead find therapies that acknowledge this and aim to calm the nervous system. I found plenty of evidence to suggest that a multimodal approach, including massage, self-care, and sharing knowledge about chronic pain, are all effective in the treatment of persistent shoulder pain. Now, if you're not familiar with the Jing method, this pretty much sums it up. It's a multimodal approach incorporating massage, self-care, and knowledge sharing. And it's particularly worth noting that the techniques adopted in the massage element not only target soft tissue release and mobility around the rotator cuff, but they're also holistic, which has a calming effect on the nervous system. So if you're still imagining that you have long-term shoulder pain, you probably want to know how my participants fared. So let's see. The study consisted of a 6-week control period with no intervention, and that was followed with 6 sessions, 1 per week, of in-person clinical massage treatments, self-care, and sharing of knowledge about chronic pain. And we measured progress throughout using a tool called the Shoulder Pain and Disability Index. Here's the results. The left shows the control period. The red mean line shows little change in pain and disability. The right shows the intervention. You can see the red mean line dropping, showing decreasing pain and disability. We had an overall reduction of 54%, and some participants recorded an 85% improvement. But that doesn't tell the whole story. My cohort improved in 3 quite distinct groups. Alpha made significant progress, Bravo moderate, and Charlie minimal. So why, you ask, did some people make significant improvement and some only marginal? Well, that is perhaps the key learning from my study. The evidence, as I suggested earlier, shows that chronic pain is complex. The 2 participants who made the least progress continually reported high levels of stress and anxiety in comparison to the other participants. And this, I think, backs the argument that chronic pain persists, at least in part, due to psychological and social factors. So to conclude, of course, this was a small study and we could learn more from a larger study, and also by measuring pain and disability beyond the intervention period. However, the study has helped me to more fully appreciate that the Jing method is not simply a fix. It's a multimodal approach which helps the individual to identify what may be affecting their pain and to make change. Now, those changes may not be identified, they may not be acknowledged, and it may not be possible to make change. But having said that, as a therapist, helping someone to identify and potentially address the real cause of their pain is probably of much greater value than a quick fix.